how are you today?
Good, how about you?
Good. My name is Carson. I'm going to be your nurse today. Could you please verify your name and date of birth for me?
Joshua Tessinia, September 7th, 1987.
All right, is it okay if I call you Joshua?
That's fine.
All right, thank you. So what I'm here to do this morning is a quick head to chest assessment on you. It's going to take me about 15 minutes or so. And what that entails is me looking at your eyes, your nose, your mouth. I'm going to listen to your heart and lungs and do a few tests. Is that okay?
Absolutely.
All right, thank you. And do you have any pain right now?
No.
Do you have any allergies?
No.
Okay, great. All right, so before me I have a Caucasian male who appears his stated age. His posture is erect and relaxed. He is in no apparent distress. There are no visible equipment in the room. Let's see. Okay. I don't see any obvious physical deformities. Stature is mid-stature. Body building contour is appropriate, and skin and facial features are symmetric and appropriate for ethnicity. Okay. So, could you tell me what brings you to the clinic today?
Just a follow-up.
Just a follow-up, okay. And can you tell me what day it is?
That's what we want. June 2nd.
All right.
Friday, June 2nd.
Awesome. So my patient is alert and oriented times 4. Okay. So first thing I'm going to do is put on some glue. And I'm just going to incorporate my skin assessment throughout the entire assessment. So I'm not going to start there. I'm going to start by palpating your head. Okay. So I'm looking at the head. Hair is evenly distributed. There's no signs of infestation and no lesions. Do you have any tenderness?
Nope.
Okay, head is normal cephalic. I'm gonna go ahead and take a look into your eyes. If you can just look straight ahead for me. Okay. All right, awesome. And if you can look at that wall and then look at my finger. Okay. Perla is intact. I'm also going to have you pull your eyelids down for me. The conjunctiva is pink and the sclera is white. Thank you. And his eyebrows and eyelashes are evenly distributed. Okay, I'm going to take a look into your nose. So tilt your head back for me. So the septum and nose is midline. There is no polyps or lesions present. The mucosa is pink and moist, and also your patient has some hair in the nose. All right, so I'm gonna take a look into your mouth. All right, can you open up for me? Say ah. All right, uvula rises midline with phonation. Teeth, lift your tongue for me. Teeth are well adhered to the gum. There are no lesions present in the floor of the mouth, and the frenulum is intact. Can you stick your tongue out and to the outside, lift up and put it down? All right, awesome. Let me say one more again. Okay. I can see the posterior pharyngeal wall is pink. The tonsils are 1+. All right, thank you so much. So I'm gonna go ahead and palpate your ears. Do you have any tenderness?
Nope.
Okay, I'm gonna look for some skin breakdown. And there's no skin breakdown. Okay, Joshua. So what I'm gonna do now is test your hearing. If you could put your finger in this side in your ear and push it in and out. And I'm gonna whisper 3 words, and I want you to repeat what you hear. Okay? Okay?
Yes, ma'am.
Okay.
Cat. Dog. Ant.
And then I'm going to do the same thing on the opposite side.
Light. Tight. Dynamite.
All right. So cranial nerves 2, 3, 4, 6, as well as 7 and 8 are intact. Okay. So now I'm going to look at my patient's neck, and his trachea is midline. Could you turn your head to the right for me, to the left, and can you lift your head up and put it down to your chin? Thank you. And then I'm going to have you shrug your shoulders for me, and then turn your head against my hand. Don't let me push it, and do the same for this side. Okay. Cranial nerves 9, 10, 11, and 12 are intact. Now I'm going to feel for your lymph nodes. So let me know if you have any tenderness as I palpate, okay? All right, so this is your preauricular. Any tenderness?
No.
Postauricular. Occipital. Okay, and then I'm going to feel in here. So jugulo-digastric, submandibular, submental. And if you would turn your head that way for me, I have the superficial cervical chain, no tenderness, as well as your deep, and then posterior here. And I don't feel anything, and I'm gonna do the same thing on the opposite side. So if you would turn your head that way, no tenderness,
No.
and here. Any tenderness?
No.
All right, so lymph nodes are non-palpable. All right, so, oops, sorry. All right, so now I'm gonna look at the skin on your arms, and temperature is warm, skin is dry, capillary refill is less than 3 seconds. I'm also going to feel your pulses here. Okay. I don't know if it asks for your carotid pulse, but I'm gonna check that because I forgot. Carotids are 2+ bilaterally. Okay, now I'm going to inspect your chest. So I would just look, he would have on a tank top, so it would be easier for me to visualize. But I'm looking for symmetry of the chest. Can you lift your arms out? Awesome. So AP diameter is 1 to 2. Chest is symmetric. And if you could sit up for me, I'm gonna go ahead and auscultate your lung sound. So I'm going to place my stethoscope on your chest. Every time I move it, I need you to take a deep breath in through your nose and out through your mouth, okay? Take a deep breath. Good. All right, awesome. Good. Awesome. All right, and then I'm going to do the same thing on the back side. I'm looking at my patient's spine, and the vertebra is straight, no scoliosis or kyphosis noted, or lordosis. Okay. Do you have any tenderness?
No.
No? All right, so I'm gonna go ahead and listen once again. So take a deep breath for me. And again. And one more time. Again. One more time. Again. And then I'm gonna have you lift your arms, take a deep breath. And lastly, we're gonna do this side. Great. All right, lung sounds are clear to auscultation. All right, I'm gonna check for symmetric expansion, so go ahead and take a deep breath. Okay, and do the same on this side. Awesome. And the chest expansion is symmetric. You guys won't have to do the tactile from this, so you can mark that off. All right, so when I inspected the chest, I also was looking for any lifts or heaves, and I didn't see anything upon inspection. So I'm gonna move on to my auscultation of your heart sounds. So you can breathe normally as I do this. So suprasternal notch, Louis, second rib. So I'm starting here. So this is the aortic area, and it's at the second intercostal space at the right sternal border. And I'm going to go straight across. Second intercostal space at the left sternal border is the pulmonic area. And S1 is less than S2 here, or S2 greater than S1. I'm going to go down one intercostal space to Erb's point, and this third intercostal space at the left sternal border. And S1 and S2 are equal. I'm going to go down to my fourth intercostal space at the left sternal border, and this is the tricuspid area. And then at my fifth intercostal space at the midclavicular line. Is the mitral area. And I could look here for a full minute to check for apical pulse. And then I'm gonna go back with my bell. S1 is greater than S2 at the mitral and tricuspid area. And I'm listening for any murmurs. And no murmurs were heard. Alright, while I have you seated, can you turn your head that way? Alright, and this way. Okay. And I don't see any signs of jugular vein distension. Alright, I believe I covered everything. Alright, so before I do that, is there anything else I can do for you
No.
right now? Are you having any pain?
No, ma'am.
Okay, are you comfortable?
Mm-hmm.
Okay. All right, well, your doctor will be in shortly, and thank you so much for your time.